In a first-of-its-kind report, Resolve to Save Lives spotlights the stories of epidemics that didn't happen, highlighting outbreaks that were stopped in their tracks by strong public health systems, excellent communications, and political support. The past 20 years have been burdened by a series of international health emergencies, resulting in lives lost and disrupted economies. Never has this been more apparent than during the COVID-19 pandemic, which soberly demonstrated that our health and livelihood is dependent on others anywhere in the world. What news outlets don't capture are the thousands of epidemics that didn't happen.
Our report, Epidemics That Didn't Happen, shows that epidemics don't have to happen. That if we work together, if we commit to finding, stopping, and preventing health threats, we can make the world a much safer and much healthier place. COVID provides us with the most teachable moment of our lifetimes. If we don't fix it now, we're not going to fix it.
It's that constant everyday work that really makes the difference. Finding those initial cases and being able to respond to 1 or 2 cases stops them from becoming hundreds of cases and then thousands of cases.
In Kenya, the risk of an anthrax outbreak was controlled in just over a month because of quick action and trust from members of the community.
Community-based surveillance is where we survey our village to raise the community, the voice of our community members, in that they'll be giving us information in case of emergence of any sign of a disease or in case of any appearance of any disease.
The Kenya action was really successful because it used networks of community volunteers like the Red Cross to engage in things that are important to communities where they are. So the thing that it really highlights is that pandemic prevention, epidemic preparedness starts all the way at the individual level in the community and needs to go all the way up into the highest levels of the government.
And we need to start working more effectively to address preparedness right from the community level. And so the interventions we develop and design should strengthen health systems as a whole.
In Brazil, a massive yellow fever outbreak was prevented by an ambitious vaccination plan and advance action.
In December 2016, it became clear to the epidemiologists monitoring the yellow fever episodics in a specific area of Brazil, in southeast Brazil, that an epidemic was imminent. There were 3 major aspects of the success of the yellow fever response in Brazil. First, the capacity of the country to increase dramatically its vaccine production and to deploy the vaccines to the population and municipalities at risk. Second, to expand in a couple of months the laboratory network countrywide, all states able to do PCR, and to use the surveillance of episodics and the modeling and the geographic information system to anticipate cases in humans approximately 1 month in advance. It means vaccinating in advance the population at risk.
We need to ensure that systems are in place in countries to better prevent, to better detect, and better respond to outbreaks. That includes ensuring that the funding is placed, the human beings are in place and trained, and that the materials required to respond to these outbreaks are available.
We need to act, and we need to act collectively.
These epidemics that didn't happen show us how the trajectory of an epidemic can be fundamentally altered when a country invests in and prioritizes preparedness for infectious disease outbreaks and readiness to act when it strikes.
With this pandemic, we have a unique opportunity to invest in public health, to prevent the next pandemic, and to ensure that as a world, we are never, ever again caught so underprepared.